Medicare might be the most confusing part of retirement. There's Part A, Part B, Part C, Part D, and then supplements, enrollment windows, and penalties on top of all that. It's enough to make anyone's head spin, and getting it wrong can cost you real money for the rest of your life. So today, I'm going to make it simple. I'll walk you through the 4 parts of Medicare in plain English, tell you exactly what each one costs in 2026, explain the 2 paths you can choose between, and show you the enrollment mistakes that can cost you forever. By the end, this will finally make sense. As always, this is for education only. It's not insurance or financial advice. So let's get into it. Let's start with Part A. Think of Part A as your hospital insurance. It covers inpatient hospital stays, a limited amount of skilled nursing care, and hospice. And here's the good news that surprises people. For most Americans, Part A is completely free. If you or your spouse worked and paid Medicare taxes for at least 10 years, that's 40 quarters, you've already paid for it and you owe no monthly premium. It's not entirely free to use, though. In 2026, if you're admitted to the hospital, there's a deductible of $1,736 per benefit period before Part A kicks in, but the monthly premium itself, for most people, $0. Next is Part B, your medical insurance. This is the one that covers doctor visits, outpatient care, lab tests, and preventive services like screenings. Unlike Part A, Part B does have a monthly premium. In 2026, the standard Part B premium is $202.90 a month, and for most people it's automatically deducted right out of their Social Security check. There's also a yearly deductible of $283. And here's the part people don't realize. After your deductible, Original Medicare only pays about 80% of your costs. You're responsible for the other 20%, and under Original Medicare alone, there's no cap on that 20%. That's a big deal, and it's exactly why most people add extra coverage, which I'll explain in a moment. Third is Part D, your prescription drug coverage. Part A and Part B don't cover most of your everyday medications, so Part D fills that gap. These plans are sold by private insurance companies, and the premiums vary quite a bit, but in 2026, the average plan runs around $35 a month. And here is genuinely great news, one of the most important changes in Medicare in years. This protection started in 2025, when the cap was $2,000, and in 2026, the cap is $2,100 a year. Before this, people with serious illnesses could pay tens of thousands of dollars for their drugs. Now, once you hit that $2,100 cap, you pay nothing more for covered prescriptions for the rest of the year. That's a massive protection. Now, Part C. Part C is different from the others because it's not an add-on, it's an alternative. Part C is also called Medicare Advantage. Instead of getting your coverage directly from the government, you get it from a private insurance company in one bundled plan. A Medicare Advantage plan typically combines Part A, Part B, and usually Part D all into one package. And many of them throw in extras that Original Medicare doesn't cover, like dental, vision, and hearing. They often have low or even zero monthly premiums, and unlike Original Medicare, they come with a yearly out-of-pocket maximum, which caps your spending. Sounds great, right? But there's a trade-off. With Medicare Advantage, you're usually limited to the plan's network of doctors and hospitals, and you often need referrals and prior approval for care. So it's more coverage in one place, but with more restrictions. So that brings us to the single biggest decision in all of Medicare, which of 2 paths you choose. Path 1 is Original Medicare. That's Part A and Part B, straight from the government. Most people on this path also add a separate Part D drug plan and a supplement to cover that 20%. This path gives you the most freedom. You can see almost any doctor or hospital in the country that takes Medicare with no networks and no referrals. Path 2 is Medicare Advantage, that all-in-one Part C plan from a private company. It's often cheaper up front and includes extras, but it ties you to a network. There is no universally right answer. It depends on your health, your doctors, your budget, and whether you travel. But understanding that this is the core choice is half the battle. Now, here's a subtle but important warning about that choice, because it can quietly become a one-way door. When you first sign up, it's easy to join a Medicare Advantage plan. But if you start on Advantage and later decide you'd rather switch back to original Medicare with a Medigap supplement, there's a catch. Outside your initial 6-month window, a Medigap company can look at your health and either turn you down or charge you far more. So someone who develops a health condition while on an Advantage plan may find they're stuck, unable to get affordable supplement coverage to switch back. I'm not saying Advantage is a bad choice. For millions of people, it's a great fit. But go in with your eyes open, because the easy door in is not always an easy door out. Now let me explain that supplement I mentioned, because it's a key piece of the original Medicare path. It's called Medigap, or a Medicare supplement. Remember that 20% that original Medicare leaves you on the hook for with no cap? A Medigap plan is private insurance designed to fill most of those gaps, especially that 20% coinsurance, and depending on the plan, the deductibles too. These plans are standardized and sold by letter, like Plan G or Plan N, so a Plan G from one company covers the same things as a Plan G from another. You're really just comparing price and service. But here is the single most important timing rule in all of Medicare. When you first turn 65 and enroll in Part B, you get a one-time 6-month Medigap open enrollment window. During that window, a company cannot deny you or charge you more because of your health. Miss it, and in most states, they can look at your health history and turn you down or charge you much more. So that window is precious. Do not let it slip by. Let me make the costs concrete, because all these numbers can blur together. Say you choose the original Medicare path in 2026. Your Part B premium is about $203 a month, roughly $2,400 for the year. Add a Part D drug plan at around $35 a month, and a Medigap Plan G supplement, which often runs somewhere between $140 and $200 a month, depending on your age, your location, and the insurer. All in, a typical person on this path might spend somewhere in the neighborhood of $400 a month. But in return, that Medigap plan covers most of the gaps, so a hospital stay or a big medical bill won't blow up your budget. With Medicare Advantage, your monthly cost is usually lower, sometimes little more than your Part B premium, but you take on more co-pays and out-of-pocket costs when you actually use care. That's the real dollar trade-off between the two paths. A quick word for higher earners. If your income is above about $109,000 as a single person or $218,000 as a couple in 2026, you'll pay an extra surcharge on top of your Part B and Part D premiums. It's called IRMAA, and it's based on your income from 2 years ago. So the income on your tax return today can quietly raise your Medicare premiums 2 years down the road. Something to keep in mind as you plan withdrawals. Now, the part that trips people up the most, and can cost you for life, is enrollment timing. You get what's called your initial enrollment period, a 7-month window around your 65th birthday, the 3 months before the month you turn 65, your birthday month, and the 3 months after. If you're not still working with employer coverage and you miss that window for Part B, you can face a late enrollment penalty of 10% for every 12 months you delayed. And that penalty is permanent, added to your premium for the rest of your life. Part D has its own late penalty too. So please mark your calendar as you approach 65. These deadlines are unforgiving, and missing them is one of the most expensive mistakes in retirement. I also want to be clear about what Medicare does not cover, because people are often shocked. Original Medicare generally does not cover long-term care, things like an extended nursing home stay or in-home custodial care. It typically doesn't cover routine dental, vision, or hearing, and it does not cover you outside the United States, which, if you've seen our videos on retiring abroad, you already know. These are real gaps you have to plan around, whether through a supplement, a Medicare Advantage plan, or separate savings. So let's turn all of this into 3 clear steps. Step 1. Understand your 2 paths and pick the one that fits your life, either original Medicare, Part A and Part B, plus a Part D drug plan, plus a Medigap supplement for maximum freedom to choose your doctors. or Medicare Advantage, the all-in-one Part C plan for lower upfront cost and extra benefits, but with a network. Ask yourself, how's my health? Do I want to keep my specific doctors? And do I travel? Those answers point you to your path. Step 2. Enroll on time. This is the one you cannot get wrong. Watch your 7-month window around 65, and if you're going the original Medicare route, absolutely use that 6-month Medigap window when you can't be turned down for your health. Getting the timing right protects you from lifelong penalties and locks in your best coverage. Step 3. Get free, unbiased help and review every year. Every state has a free Medicare counseling service called SHIP, the State Health Insurance Assistance Program, where trained counselors help you compare plans with no sales pressure. And each fall, during Medicare's open enrollment from October 15th to December 7th, you can review and change your plan. Your medications and your health change, and so do the plans, so a quick review every year can save you real money. Here's the bottom line. Medicare feels overwhelming, but it really comes down to this. Part A is your hospital coverage, Part B is your medical coverage, Part D is your drugs, and Part C, Medicare Advantage, is the all-in-one alternative. You pick one of two paths, you enroll on time to avoid those permanent penalties, and you get free help to choose your plan. Do that, and you've handled one of the most confusing parts of retirement like a pro. It's not as scary as it looks once you know how the pieces fit. If this finally made Medicare make sense, do me a favor and subscribe. Every week, we break down retirement in plain English, how to make your money last, how Social Security and Medicare really work, and how to retire well, whether that's here at home or somewhere more affordable abroad. And if you know someone approaching 65 who's stressed about all this, share this with them. It could save them from a costly mistake. Thanks so much for watching, and I'll see you in the next one. One last thing. This channel is for educational and entertainment purposes only, and it is not insurance, financial, tax, or legal advice. Medicare rules and costs change every year, and the right choice depends on your personal situation. So please confirm the current details at medicare.gov and consider speaking with a licensed Medicare counselor or your free SHIP program before making any decisions.